Hey everybody, this is Dr. Paul Thomas with Plum Health DPC, and then today I have a very special guest on the show, and it's Tom, and we're talking about my face shield. Hey Tom, thanks for coming on, and let's
Hey,
talk about these face shields.
thanks, man. I really appreciate it. Just wanted to talk a little bit about what we've been doing. These are a new product that we've come out with. These are injection molded face shields. And we have a new company called My Face Shields, spelled MI Face Shields for Michigan, because that's where we're based. And these came about because of the pandemic that's going on as a volunteer effort, teaming up with an injection molding company called Polyflex here in Michigan. And we were able to make 30,000 of these and donate them to healthcare workers and frontline workers around the area in the last few weeks. And now we're selling them through a give back program.
That's awesome, man. And so like, how did the design come about? How did you design it? How did you make it? Because you did this really quickly.
Right. So we ended up starting with one of the open source designs that was out there in order to meet the demand for the healthcare workers, but with quite a few modifications that allowed it to be made out of a single material with this snapback type closure. So this is a material called HDPE, which is a very flexible plastic. And this is called PET, which is a really common clear plastic material. And this is laser cut. And this is injection molded. And the cool thing about these is that they are, when they're manufactured, the bands here are not touched by human hands. They go from the injection molding, the mold, removed by a robot, cut by a robot, and then another robot puts them in a box. So
Wow.
that's a really cool part of the process. And we worked with the engineers over at the company Polyflex to modify the design and test it to make sure it was good for production in injection molding.
Well, I got to say thank you for the delivery because I got 60 of them and they look great. I mean, they work really well and it's a good way to protect yourself for us and our staff when patients come
Awesome.
through
Yeah.
because, just we have the mask. I'm not wearing a mask right now because we don't have any patients in our office right now. But whenever we have patients in the office, we'll throw on the mask and then we have the face shields as well. And it's just that second layer of protection that gives us a little bit more peace of mind because a lot of people don't know that the virus can live on your face, on your clothes, on your eyebrows, eyelashes, etc. So just this gives you just one more barrier to protect yourself and your patients. If you're looking to have something like this, I think it's a really useful tool. So then tell us about the production. Like, how did you ramp up so quickly? How did you do this?
So it was originally 3D printing, and Polyflex actually approached our volunteer group and said, hey, we are injection molders for the automotive industry. We're suppliers. We feel like because of our capacity and our abilities, we have kind of a moral obligation to help. So how can we be part? So by working with them, they got a hold of a lot of their suppliers to see if they would bring in materials. And we just worked together kind of around the clock, tweaking the design and 3D printing prototypes until it was ready for tooling. And then they tool an aluminum die, which allows you to make, right now, 2 headbands at a time. And that can be tooled up to many, depending on the demand from here on. But with those two cavities in the mold, they can make up to 30,000 of these per week.
Wow.
Just running around the clock.
It's amazing.
Yeah.
Well, this is awesome. And then you said you donated us a small amount. We got a handful of these at our office, and then you donated a lot to the other hospital groups. And then basically you're doing like a give back. It's kind of like, I don't know, is the Tom shoe model appropriate?
Yeah, it's not quite one for one. We're not able to do that right now, but Polyflex is able to give back 5%, which equates to 1 shield for every 18 that we sell. And so, depending, some places need thousands. We ended up donating over 1,000 to the Detroit Fire Department, a lot of fire, EMS, obviously hospitals, but a lot of private practice. So it may not sound like a lot now, but one for every 18 can add up pretty quickly.
Yeah, and
And that's very generous of them.
yeah, it gives somebody like a fire department worker or a police officer a little bit more peace of mind, or your
Exactly.
staff at a hospital more peace of
Exactly.
mind to have it. I know it's been nice having it here
Right.
to wear.
And these
Um,
are they're reusable too, which is important to know, because a lot of the ones that are currently out there are not. They can't be cleaned or sterilized. They're pretty much disposable. So these can be cleaned, and if the face shield actually gets too marred up, it can be just replaced, and the headband can be kept. So
yeah.
they have a little bit more of a shelf life than most of the shields out there.
What's your recommended disinfectant for the headband?
A mixture of isopropyl or a hydrogen peroxide mixture, and we
Hmm.
have all of that information on the packets that come with the products. And if anybody has more questions, they can obviously reach out to us.
And again, you're at mifacieshields.com, right?
Yep, that's right. mifacials.com. Also at mifacials on Facebook.
Awesome. Well, Tom, thanks so much for the work you're doing. And hopefully this reaches a lot more people and gets the word out about these face masks. And
Awesome.
sincerely, thanks for the work you're doing here.
Absolutely. Thanks, Dr. Paul. Thanks for having me.
Oh, you're welcome, man. Thanks
Okay.
everybody for watching, and have a great day. Stay safe out there. And if you're looking for these, again, they're at mifacieshields.com. All right. Take care.